and welcome back to Fix Your Relationships podcast. I'm Dr. Tiff, your personal growth and relationship transformation coach. Such a long title, but it encompasses all the things. If you are a frequent listener and you listened to the last episode, you know that I am leaving room for the Holy Spirit here. I'm in that season where I am not over preparing, but just making sure that, I bring a few notes to the session and give you what you need, but also leave room for God to just tell y'all what he wants y'all to know, because sometimes it comes to me and I don't, I be trying to do too much. He's like, look, sis, move aside. I got something to say. And this would be a lot easier if you would just let me do it. So this is me letting him do his thing. Okay. All right. So you are here for Fix Your Relationships podcast. What I do is I help women learn how to effortlessly call in and attract the love and the life that they desire and deserve while focusing on their own growth and transformation. That is what I do. Okay. That's what I do. And I do that in the form of this podcast, Fixing Your Relationships. And fix your relationships doesn't just mean our romantic relationships. It means all of our relationships. So we talk about work. We talk about family. We talk about friends. We talk about love, right? And so we want to try and fix all of that. But in doing so, the very key part of what I do is about helping us women, right, learn how to do it by focusing on ourselves. That's the big thing. Too many of us are focused on everyone else and getting everyone else together. And in the meantime, in between time, we're not doing what we need to do to get ourselves together. And so my job is really about helping you do what you need to do so that when the right job, when the right relationship, when the right friendship, when the right family, when everything comes together, you're ready for them. Okay? You're ready for them. So today I want to talk to you guys about outsmarting your anxiety. How to outsmart your anxiety. Our emotions, sometimes people, when you say things like depression or anxiety, sometimes people think that you're talking clinically, like a diagnosis, and that's not what I'm talking about. Yes, I am a licensed therapist, and the information that I'm giving you here today does not take the place of you going and seeing a therapist. And certainly if you suffer from debilitating anxiety, I would encourage you to seek out mental health treatment. Or at the very least, talk to your primary care physician or your OBGYN, someone. Talk with a medical professional about it, okay? You don't have to live like that. It is tough as someone who at times, from time to time, has experienced anxiety. It can take your breath away, like quite literally. And I don't want you going through that. So if you are struggling with anxiety, please reach out to your doctor, get referrals for a mental health professional that can help you along the way. Anxiety is excessive worry. And this won't be an all-encompassing definition, but anxiety is feelings of excessive worry, of dread, nervousness, restlessness. Sometimes when people are super anxious, they're unable to, get a good rest, get a good sleep. They have the queasiness sometimes in their stomach. Sometimes anxiety shows up as fatigue and avoidance. There's so many different ways in which we can express those feelings of anxiety. And it's one of those things when you know. I was having some trouble with a medication at the end of last year, into 2024. And I just couldn't feel, I was having these little patches, and I didn't know it. Okay. Let me just tell you what it was. Okay. I was taking this medication and I didn't know I was having it, but I went to go get my hair done. And as she's like separating, parting, detangling, blow drying my hair, she's like, "Did you know you had this patch right here?" And I was like, "What do you mean patch? What are you saying to me right now?" She's like, "There's this little thing." And she gives me the mirror and turns me around so I can see the back of my head. And I was like, no. Yep. And so she kept going through my hair and she was just, let me just see. There was another one. on the other side of my head. And they were very small. I would say probably about the size of a dime. And thankfully my hair is thick, so I didn't know it was there, and it wouldn't, like, unless I parted my hair right at that spot, I wouldn't have known it, wouldn't have seen it. And because it was kind of in the back of my head, to the side in the back, I never saw it. And if I hadn't gone to see her, I wouldn't have known it was there. So I'm like, oh my gosh, what is going on? Oh my gosh, I'm freaking out, right? And so while I'm in the parking lot, I left the salon, and in the parking lot, I did not even drive home. I went ahead and called a dermatologist and got an appointment immediately. I was going out of town. I remember I was going out of town the next week. And so I had a very short window, and I actually ended up having to do the appointment after I got back in town. But I was like, listen, they're going to have to see me, because I can't be out here and my hair falling out and I don't even know it, and I don't even know why, right? So this is like another symptom. This is yet another symptom of anxiety. For some people, it's stress related. Sometimes that stress manifests in different physiological changes, like hair coming out and things like that. And that can be even more distressing when you're experiencing those types of symptoms. So anxiety looks very different in a lot of people. And this was one situation that caused me a significant amount of anxiety, because we could not figure out why I was losing my hair. I knew that I had started taking this medication, but I couldn't, for the life of me, I was like, that's not why. It didn't even dawn on me until months later that maybe this was a side effect of this medication. And so I went back to my doctor, and she was like, yeah. She's like, it's a very, very rare side effect. She's like, I've been treating patients for, 20 something years. I've never seen it, but it is a side effect. So let's get you off of that pronto. And thankfully, since I'm off of it, like, the hair is starting to come back. And your girl's good. She's good. She's good. It's starting to grow back. Those little patches are, it's got a little fuzz there. We're doing it. We're zipping and doing it. It's looking good. But how to outsmart your anxiety. Now, there are some times when you can't outsmart it and you need to go see somebody. You got to go talk to a man about a mule, okay? You got to talk to people about your anxiety, and that there's nothing wrong with that. I want you guys to hear me when I say the tips and tricks that I'm going to give you today. I'm going to give you 4. There's for situational anxiety. And what I mean by situational anxiety, you are experiencing a certain situation that is causing your anxiety. I'm not talking about generalized anxiety disorder, okay? I'm not talking about an anxiety disorder that you've been diagnosed with that is pervasive and persistent. I'm talking about what I noticed on my way to that first doctor's appointment when I was going to do the hair, for her to look at my hair. I was so anxious on my way to that appointment, unreasonably anxious. Now, I have been to dermatologists before. I have a dermatologist that I love. I wasn't going to see her for this for a very specific reason, because this was my hair. Okay. And I needed a specific dermatologist to look at my scalp. Okay. My thing, don't worry about it. Okay. We'll talk offline as to why I went to a different dermatologist. Anyway, on that particular day, like I went back in my mind and I thought about a previous dermatologist that I had gone to years and years ago, probably over a decade ago, probably 2 decades ago. I had gone to this dermatologist one time, and it was after like maybe pulling my hair in certain styles or wearing weaves or braids or something. And I had some little patches, right? And so I'm like, oh my gosh, is this happening to me again? What is this? And when I went to that dermatologist, he had to do a scalp biopsy. Now, y'all know what a biopsy is where they take a piece of whatever it is so that they can analyze it. I'm already not great with needles. I don't like pain. Put me out, okay? I don't need to experience it. I don't need to know what's happening. I don't want to be there. Okay. So when I got in his chair all those years ago, and he was like, we're going to need to do a biopsy of your scalp. I'm like, oh, okay. So does that mean I'm having surgery? Are you going to put me to sleep? Do I get some Versed? Do I get some propofol? What am I going to get? He was like, oh no, we doing that right here in the office right now. And I'm like, what? Excuse me? Who said? Because I was like, no, we not. But alas, I did it, and it was not great. Okay. I got queasy, got lightheaded, was not really it hurt. They gave me something supposedly to numb it, but I was freaking out. They got the biopsy, and everything, but it was the worst experience ever. So I think that was what was triggering the anxiety. Also, it was a new doctor, so I'd never seen her before. And so I'm like, I don't know what she's about to do. Like, she is going to cut my scalp open. I'm here. I don't know what to do. But at the same time, like, I need help. I need to know what's causing this and what to do about it. And so I got to the appointment. I told the nurse my concerns. I let her know that I was not looking forward to a scalp biopsy, and I didn't know what to do. And, long story short, the doctor came in, she was great. And she was like, you don't need a scalp biopsy, girl. This is going to be fine. It's going to grow back. It's not all the laundry list of things that I thought it was, right? That I'd already told myself that it was. And so from that point on, I say all that to say, I get anxiety too, okay? But mine tends to be more situational than just persistent. I know I went around the world to give you that story, but I thought it was important. Maybe it helps somebody. All right, so I'm going to give you today 4 ways, back on task. I want to give you today 4 ways to outsmart your anxiety. If you're feeling any of the feels that we've been talking about today, and even if you've experienced some other things that you have named anxiety, and we want to alleviate ourselves from those feelings, I want to give you some words of encouragement, but also let you know that you can do this. You can do this. You can do this hard thing. And this hard thing in this moment is anxiety. Number 1, and this is going to sound wildly oppositional to anything you think a therapist might say. But if you're struggling with something, you know what? Actually, I'm going to give you 5. I'm going to give you 5 of these. I'm going to give you 5 because I just came up with another one that's not on my list, but I think I'm going to say that one first so I don't forget it. Number 1, give yourself permission to be anxious. There you go. Thank you for coming to my TED Talk. Give yourself permission to be anxious. Anxiety is a normal, natural emotion. We all have access to this emotion. There is nothing wrong with being anxious. Anxious is being excited, except we think about it in a negative way. But if you think about it, anxiety and excitement, 2 sides of the same coin. One's positive, one's negative. We all have the ability to be anxious about something, especially something that we don't want to do or something that we've never done. It's a feeling that you get when you don't know what's happening on the other side, or maybe even when you do know what's going to happen and you don't like it, or you don't want it. There's nothing wrong with being anxious. I have found, and I do this too, when I am feeling anxious about something, especially if I know it's unreasonable that I'm being anxious about, that I feel anxious about it, but I feel it anyway. The one thing that I do is I say out loud to myself, I am feeling anxious. I say it out loud. I name it. This is my anxiety. I am feeling anxious right now. And there's something about saying it out loud as opposed to suffering in silence that makes me feel a twinge better. What makes me feel even more better or makes me feel even better is when I say it to someone else. When I name my anxiety, give myself permission to feel anxious. And then I say, like I said to my doctor that day, and I said it to anybody that was going to listen, I'm feeling really anxious today. You know what happened as a result of me articulating that and saying to those people, I'm feeling a little anxious today? They calmed me down. They gave me the verbal and even the physical. The nurse ended up hugging me before I left. Child, they know I was broke down. I was a mess. Okay. But they just came and said, let me ease your anxiety. You don't have to worry about this. Here's what I think. Here's the plan. Here's what we're going to do. You're going to come back. We're going to revisit. I'm going to take pictures. We're going to make sure you're okay. You're not doing this alone. We got you. When you name your anxiety, when you say it to yourself, acknowledge it, allow yourself, give yourself permission to be and feel what you feel, and then you let other people know, hey, Your girl's feeling some things that she doesn't like. I'm in a way. I'm in a very bad way. It opens the door for people to be there for you, for your community to wrap their arms around you and let you know that you're not by yourself and that they got you. They're going to hang in there with you. So that's going to be number one. Give yourself permission to be anxious. Okay. Number two, set aside time to worry. Now, this is the one. That's the one I was going to start with, but set aside time to worry. I think that it is important that in addition to acknowledging our feelings of anxiety, that we also just give ourselves permission and time to worry. If you say, you know what, I'm really struggling with anxiety right now. For the next 5 minutes, I'm just going to allow myself to be anxious. I'm going to worry and worry and worry and worry because I got other things to do. And those things aren't getting done because of this anxiety and worry. So I'm going to time myself and sit here and allow myself to worry about it for 5 minutes. But after that 5 minutes, I have to do something else. I think that when you give yourself, and I say all of this, with a smile on my face, but when you give yourself the time to worry and ruminate about the thing that you want to worry and ruminate about, you don't usually use up all that time. At some point, you're like, okay, this is boo. I got to move on. I've done enough. Okay. So give yourself 5 minutes, 15 minutes, whatever time you need to worry, to really just pour into the worry, to allow yourself to worry so that you can move on and do other things. When you're giving yourself the dedicated time to do that, you'll find it freeing because you're able to now focus a little bit more freer on the other stuff that you actually need to do. Okay. All right. That was 2. This is number 3. Focus on your breath, right? Focus on your breath. Now, if you're in full-blown panic attack mode, this is going to be very difficult. But remember, the things that we're talking about here are more situational, not necessarily acute or clinical. And one of the things that I like to encourage people to do when we're feeling anxious, that I encourage myself to do, is really focus on my breathing. A lot of times when we're anxious, we hold our breath and we don't realize it. We breathe really fast, or we just we're frozen and we're not even paying attention. Focusing on your breath is more about, it's a couple of things. It's slowing you down, allowing you to be very present and in the moment. Focusing on your breathing also forces you to focus and pay attention on one thing rather than the many things that might be causing the anxiety for you. It's shifting your focus to something that is absolutely within your control. A lot of times when we're anxious about something, it's something that's out of our control. And that's why we're anxious about it, because we can't control it. Your breath, though, is something that you can control. Nobody else can control it for you. You can do that. You can do this. So there's the 555 or 444. You can do 888, whatever number that works for you. Do that. Use that number. I'm going to do 4 for the purposes of what we're doing today, but I've heard 555. I've heard 8s. I've heard, 4, 5, 6, whatever works for you. This breathing technique is just about breathing in for a certain number of seconds, holding that breath for a certain number of seconds, and then exhaling for a certain number of seconds, and then doing that a series of times. So what that looks like is breathing in for 4 seconds, holding it for 4, and exhaling for 4. And then you do that, I would say, at least 4 or 5 times in a row, making sure that you're giving yourself the time that you need each time. 4 seconds in, 4 seconds to hold, 4 seconds to exhale. And once you finish this series of, let's say, 4 or 5, you will find yourself, one, is getting more and more oxygen to your brain so you can think a little bit better. It slows you down and allows you to be a little bit more present in the moment as opposed to just in your head and full of worry. And it gets your heart rate back down as well. So I want you to try that. Keep that in your arsenal. Focus on your breathing. You'll also find that when you're focused on your breathing, you're not focused on the thing that's worrying you and causing you anxiety. So that's why I like that one. All right. This is not third. This is the fourth. The fourth thing, my numbers are all off because I added the 1. The fourth thing on the list is be intentional about your self-care. Being intentional about your self-care. So just like I said, the second example was set aside time to worry. I'm going to tell you, set aside time for your self-care. Be very intentional about it. Schedule it. Put it on your calendar. If you know that you have a high pressure situation coming up, something that is causing you anxiety, if you know, let's say, even if, well, you do know this. So even if you have tremendous anxiety around driving in traffic. I live in Atlanta, so the traffic is a lot. Okay. And it can be very, very stressful for some people. If you know that that brings about anxiety for you, then perhaps on the front or the back end, you set aside some time for, let's say, the breath work. You know what? I'm going to drive to work in all of this traffic, but I'm going to get there at least 5 minutes early so that I can sit in my car and do my breaths so that I can calm myself down before I have to go into this job. That is being intentional about self-care. That is saying, I know the anxiety is coming, will come, has come, will come again. What can I do to support myself through it and be intentional about taking care of myself? If you know that going to the doctors or to the dentist, let's say the dentist, you know that every time you go to the dentist, you are strung out, rode hard and put up with. I have so much anxiety about being in the dentist's office. You just can't take it. Perhaps that's your mental health day. Perhaps that's the day you don't force yourself to go back to work. Maybe you treat yourself to a delicious lunch after. Maybe you just allow yourself to go back home and take a nap. Okay. That's being intentional about your self-care. A lot of people think about self-care in terms of, oh, well, let's get a manicure and a pedicure. Let's go get my hair done. Yes, you are taking care of yourself. Those are things. Yes. But what's also a thing, what's also being intentional about self-care is looking what causes you stress, distress, discomfort, and looking for ways that can replenish, soothe, and revive you. Okay. So being intentional about your self-care and really scheduling, like literally putting on your calendar, scheduling those things in. If you are someone who skips lunch every day, and I'm one of those people, I have to be intentional about eating something during the middle of the day, because once I start focusing on work, I just go straight through. And by the time I look up, it's 4:00 and I haven't eaten. And then I don't want to eat because it's so close to dinner, and then I won't want to eat dinner, but I still got to cook dinner because these people in my house got to eat. So yeah, it starts. But then when I don't eat, guess who starts feeling anxious and jittery because she ain't ate? Me. So I have to be very intentional about my self-care. And I've told you guys before on the podcast, like I put snacks and things like beef sticks or nuts and things like that at my desk so that and my stomach growling right now, so that if I know that it's time to eat and I'm hungry and I just don't feel like breaking and stopping for work, it's there and I can just grab it and continue to do what I'm doing. So it's a workaround for me. I do have to be very intentional about that, but that's just something, that's me. All right. And number 5 on our 5th way to outsmart our anxiety, practice guided meditation. Now, I know what some of you are going to say. Dr. Tiff, I can't meditate. I already done told you I'm anxious. My brain is all over the place. I can't quiet my thoughts. I got too much on my mind to be sitting there meditating. And what I'm going to tell you is, if you know how to worry, you already know how to meditate. Meditation and worry are pretty much the same thing. It is focusing your attention on something and not thinking about nothing else. So when you worry, you are focusing your attention on a problem. When you meditate, you're focusing your attention on God's answer, on scripture. You're listening rather than worrying. You're waiting rather than worrying. And to say that you can't focus it on anything, you can, because you're able to focus and ruminate and just not let go of something in the realm of worry and anxiety. Your brain can do this. I know it can. It is hard. It is a practice. And that's why we talk about meditation as a practice. It's just like anything else that you do that you're new at. It's difficult at first. But one of the things that I think one of the more common things that I hear people say when we talk about meditation is, my mind wanders off or these random thoughts pop in. And what I say to that is that's perfectly normal. That is absolutely what our brains do. And in the next podcast episode, I'm going to talk more about this. So I'm going to stop right there with the 5 ways to outsmart your anxiety, meditation being the 5th, and knowing that even though you feel like you can't do it because you're so anxious and you're so wound up and it's a lot to worry about, if you're able to worry, you are able to meditate. And we'll talk about how you do that in the next podcast episode. So I'm going to end it there. I want to thank you so much for joining me today for Fix Your Relationships podcast with Dr. Tiff. I hope that you'll continue to join me. And like I said, in the next episode, we're going to be talking a little bit more about that fifth way, which is practicing guided meditation. And if you'll humor me, if you go down into the show notes, you'll be able to get my Releasing the Stronghold of Anxiety link. I created a meditation just for this, right? For releasing anxiety. So you can do that in the show notes. And I'm pretty sure the link is there. All right. Take care, and I will talk to you soon. Bye. Hey there, it's me, Dr. Tiff. I hope you found this episode helpful. The goal of this podcast is to help you improve your relationships, but we just can't do that without focusing on ourselves first. If after listening to this episode, you're thinking, hey, I might want to give guided meditation a try, just go to the show notes and click the link to download my guided meditation, Releasing the Stronghold of Anxiety. I developed this meditation for those of us who have a little difficulty moving on and letting things go. When I'm in that place, I'm also filled with lots of anxious feelings that I just can't shake. This meditation has helped me tremendously, and I have a good feeling that it'll help you too. Just tap the link in the show notes for a full list of all available downloads.